everyone, and thank you for the opportunity to speak today. Many of you will know me. I'm Emer Mulvaney from Cancer Trials Ireland, where I work across contracts alongside the startup team and patient engagement. So a lot of the members of the PCC are here today, which is fantastic. So today I want to focus on one particular part of the clinical trial pathway, which we believe represents both a challenge and a major opportunity for Ireland. The period between trial approval and actual site activation of the study, because ultimately every delay in activation is time for patients and delaying their access. So the reality, this slide really sets the context for why this work matters. And according to the recently published EFA Clinical Trials Activity Comparison Report from 2025, Ireland ranked as the slowest EU member state from the time from EU CTR approval to first site ready, with a median activation time of 213 days. Now we can see the pillars, the light blue pillars, that time is improving, but we're still quite a way off from the NCTOG report recommendation of 42 calendar days. This time directly impacts patient access, but also our site competitiveness, sponsor confidence in Ireland, and future research opportunities. Okay. So what have we been doing at Cancer Trials Ireland? Well, we've continued to focus over the last 18 months or so on streamlining clinical trial setup processes and reducing delays to activation. We currently work across contracts, budget negotiations, ethics coordination, data protection and governance, site activation and readiness, and early engagement and issue resolution. We're continuing to see improvements in key timelines, and one I'd particularly like to highlight is our Q4 2025 to Q1 2026 site agreement issued to executed has dropped by 45% from 73 days to 40 days as a median time, with some sites turning them around in 2 days and other sites a little bit longer than that. I think it's really important to acknowledge the absolute collaborative work that has been ongoing, and in particularly I'd like to thank Dr. Claire Brady from the Cork area, who has been liaising with Cancer Trials Ireland and the HSE to design a template agreement for our non-regulated studies, which would mean that we have template agreements for all studies. However, you will see that our ethics approval to site activation timeline has worsened, up 21%. So this slide is intentionally busy. I suppose it just goes some way to show all of the tasks that have to happen from ethics approval to site activation, and there's definitely some that aren't here. To pick a few: contacting, training, document collection, other local approvals, our SIVs, being ready to go. So our focus for the second half of this year is looking at that particular time period between ethics and activation. And while important progress has been made under the CTR, that period of ethics approval to site activation remains a key challenge. So the ask, 42 seconds. Cancer Trials Ireland would like to pilot with some interested sites 1 to 3 studies where we would look at working collaboratively with interested sites to pilot earlier parallel preparation during the time of ethics review, progressing our draft contracts, planning for activation, preparing study documentation, and scheduling our SIVs earlier alongside the planned timelines. We do recognise that we ourselves have a lot of work to do in this area, but we are looking for partners to help us to improve. We acknowledge that site capacity and operational pressures are very, very real, and that this will not suit every study. But if we can even incrementally reduce the activation timelines, it can improve our patient access, strengthen our competitiveness, enhance the confidence in Ireland, and ultimately bring more clinical trials to Ireland, which is what we all really want to achieve. So thank you.